Hello and welcome to the peak flow measurement topic. By the end of this session, you should be able to understand the importance of peak flow measurement, understand the indications of peak flow measurement, use the proper technique for peak flow meter measurement, interpret the results, and finally, tailor management based on peak flow measurement results. Let's get started. A peak flow meter is a tool that measures the peak expiratory flow rate or PEFR. The PEFR is the amount of air a person can quickly force out of their lungs in one breath. People primarily use PEFR measurements as a guide for managing asthma symptoms. However, doctors may also recommend peak flow measurements for people with chronic obstructive pulmonary disease or COPD to determine an increase in symptoms. How do peak flow meters work? To use a peak flow meter, you must forcefully blow into the device. The meter measures the forced air in liters per minute. The indicator on the device moves in response to the exhalation and provides a reading on a numbered scale. Recording peak flow measurements is a part of asthma action plan to help treat the condition. A peak flow meter is useful in detecting changes in a person's airway, which could indicate worsening of symptoms of asthma. Why use a peak flow meter for asthma? Patients with asthma may develop narrowing of the airways, which lowers the amount of air they can exhale. The PEFR often changes in response to a flare-up of asthma. Weather, exposure to allergens, and infections can all lead to a change in a person's asthma status. So, regular monitoring with a peak flow meter can help a patient detect changes in their airways before other symptoms begin. In some cases, a decrease in PEFR is the only sign of an impending asthma attack. Recognizing the signs of an asthma attack through peak flow monitoring and following an asthma action plan can help prevent symptoms from becoming severe. Let's see what's its use in COPD. Along with its uses for asthma, a peak flow meter can also be helpful with other lung conditions such as COPD. Patients with COPD may also develop narrowing of the airways and inflammation. By monitoring their PEFR, patients with COPD can determine what is normal for them. Just as with asthma, when there is a significant decrease in the peak flow, this is a red flag sign that something might be triggering an increase in COPD symptoms soon. So how do we use a peak flow meter? It is important to use a peak flow meter properly and put forth a good effort to get an accurate measurement. Peak flow meters have slightly different designs depending on the manufacturer, but they are all requiring the same steps. The patient should do a peak flow measurement while standing up. To use a peak flow meter, instruct the patient to follow these steps. Firstly, make sure that the indicator or pointer is set to 0. Next, ask the patient to take deep breaths. Ask the patient to put the flow meter in the mouth with the tongue down out of the way of the mouthpiece and close their lips around the mouthpiece. Then tell the patient to blow out as hard and fast. The indicator will move in response to the exhalation. Check the number on the scale next to the pointer or indicator. This is the peak expiratory flow. Move the indicator back to 0 and repeat twice more. Record the best of the 3 attempts in a chart. So what do the results mean? Peak flow predictions vary based on a patient's sex or gender, age, and height. So once you know a patient's personal best, you can determine whether or not their peak flow changes. The results of a peak flow may indicate different things depending on whether the measurement improved, worsened, or stayed the same. So the changes in peak flow may indicate the need to get emergency medical care, a flare of asthma symptoms, the medication is effective, a patient has well-controlled asthma, and a need to change daily medication. So let's get introduced to the peak flow zones. Peak flow zones interpret peak flow rates and help an individual know what steps they should take to manage their asthma. According to the American Lung Association, peak flow zones to follow include the green zone, which records 80 to 100% of personal best number, and it signifies good asthma control. The symptoms are not present and there are no early warning signs of an asthma flare up. Contrary to that, you have the red zone, which records less than 50% of the personal best number. This indicates that the patient requires medical emergency. Symptoms such as wheezing, shortness of breath, or coughing might be present. There's a need to use a fast acting inhaler, and the patient has to seek emergency care. So, in summary, a peak flow meter is a small device that measures the amount of air a person can forcefully blow out of their lungs in one fast breath. It is one indicator of airway changes that may occur in people with asthma or chronic obstructive pulmonary disease. A person's peak flow measurement can indicate a worsening status of their asthma or another lung condition as mentioned. Although it is the only one test, it can be useful to determine the treatment needed, including emergency medical care. So we have come to the end of this session. Thank you for your time.